Jaundice, caused by having a higher amount of bilirubin than usual in adults. Jaundice is always an uncommon condition, but in newborns after birth in the first week, jaundice is a normal physiological condition. This happens to almost all newborns, especially premature babies. It's caused by an imbalance in how bilirubin is created and destroyed.
1. Babies might get skin from exposure to light ultraviolet for a long time. 2. The baby might have diarrhea due to the light used in the treatment. Injury the intestinal mucosa causes a temporary lack of latex enzyme and gets better when the phototherapy is stopped.
Number 3. Babies lose a lot of water for evaporation as the baby's surrounding temperature rises. Therefore, it must be replaced by giving more milk or intravenous fluid. Number 4. The baby may have a higher than normal body temperature or fever. May be corrected by moving the lamp away from the baby.
Number 5. Your baby may have a temporary fluid rash on his body, non-specific erythematous rash. Number 6. If the baby's eyes are not completely closed, eye injury may occur because the eye was exposed to light for a long time until blindness.
Treatment for hyperbilirubinemia.
Phototherapy is a treatment for indirect hyperbilirubinemia. This is because light can cause bacterial changes. Bilirubin molecules cause isomerization of UV, which is normally insoluble in water, into a water-soluble compound that can be exuded in the urine and fed to the bladder, typically polychromic white light.
Is when in the achievement of unconjugated hyperbilirubinemia, blue skin light with of rank in the less 450 and 418 nm is backed up by bilirubin plaque efficacy for treatment, but infested blue light cause nausea and vomitiness and frustration if having to take care of the baby for a long time.
Therefore, colorless fluorescent lamps may be used. Blue and white can be alternated to increase the efficiency to treatment. The higher the intensity of the light, the more effective the treatment will be. Therefore, if the treatment is effective, the light should be kept on near the baby and increase the number of his link fibers.
Treatment for hyperbilirubinemia. Number 2. Blood transfusion. Exchange transfusion. It is the fastest and most effective treatment for jaundice. Indications for replacement: the blood for jaundice infants at 35 weeks gestation and over is shown in Figure 5. The AAP recommends that if the infant receives intensive phototherapy and the bilirubin is still elevated than the indications in each period, consider a blood transfusion. The principle is to bring blood with normal bilirubin values in adults, about 0.1 to 0.2 mg per deciliter, and replace it with the blood of infants with hyperbilirubinemia. but it has to be done by using small amounts and doing it many times to prevent the baby from getting or losing too much blood at a time until the circulatory system changes. Therefore, for effective blood transfusion, a volume of blood is twice the volume of the infant's blood. Double volume exchange transfusion.